Welcome back. My next guest is Dr. Victor Marwin, who is an orthopedic surgeon with Bluegrass Orthopaedics. Welcome.
Thanks for having me.
Now, I mentioned knee pain, hip pain. That seems like we see a lot of, but shoulder pain's right up there. So how do you know shoulder pain? Is it arthritis? Is it tendonitis? I mean, tell me a little bit about that.
Sure. I mean, the first and most obvious thing is that their shoulder hurts. There can be grinding and popping with motion, certainly weakness, difficulty reaching overhead, difficulty engaging in sports activities. All of those are common symptoms.
Are the common symptoms arthritis?
They can be. They can also be common symptoms of soft tissue disorders about the shoulder. So really, when we think about shoulder pathology or shoulder problems, we think about the joint, the bones, and we think about that wearing out in arthritis, but we also think about the soft tissue around the shoulder, and that's the rotator cuff. That's responsible for stabilizing the shoulder, and typically in younger patients that starts wearing out around the 40s and 50s, and that can lead to arthritis as well.
Okay. Now, arthritis, you make that diagnosis by X-ray, MRI?
X-rays.
And then once the diagnosis is made, how do you treat it?
Sure, there's a lot of different ways. The easiest way and most conservative way is some anti-inflammatories and activity modification. Beyond that, there can be some steroid injections that can buy people some time, but ultimately it's a joint replacement for a joint that's completely worn out. Now,
is there anybody that's specifically at risk for arthritis of the shoulder specifically?
Sure. People that have had prior trauma to the shoulder are certainly at risk. People that have had their shoulder operated on, people that have rotator cuff problems, especially long-standing rotator cuff problems or multiple rotator cuff surgeries, are all at risk.
Sports have any effect on that?
They do. You know, every joint in your body is a bearing surface, and if you use it a lot or abuse it a lot even, it can wear out. Certainly we see that in racket sport players and overhead athletes, pitchers, swimmers.
Now, you mentioned if you do all those things, anti-inflammatories, physical therapy, injections, some people end up with a joint replacement.
They do.
Is there one type fits all, or tell us about that?
There's certainly no. There are many types. There's two major categories, and that is an anatomic total shoulder replacement and a reverse shoulder replacement. So the anatomic, as the name implies, we replace the ball on the humeral side and the cup on the scapula side, and it looks like the shoulder that you had, only it's metal and plastic parts. A reverse shoulder is necessary when the rotator cuff doesn't work. So it's reversed in the sense that the ball is on the scapular side and the cup is on the humeral side.
Who's a specific candidate for that?
So in order to have a shoulder function well, you need a good soft tissue envelope. And if you don't have a good rotator cuff that's functioning well, the shoulder doesn't function well. And that's true of the shoulder that you were born with and a shoulder that we replace. So if we just replace a shoulder that's arthritic and there's not a good rotator cuff functioning, the shoulder doesn't work and it's doomed to fail. So the reverse shoulder is indicated for people that have significant rotator cuff problems or a non-functioning rotator cuff. It's a different geometry to the shoulder replacement, and it allows the shoulder to move without a rotator cuff.
And you make that decision based on the patient
yes.
specifically?
Yeah, the patient will be evaluated preoperatively. They may get an MRI scan, it may be on history, it's physical exam, all of those together.
What's the recovery time for that once you have it done?
In general terms, a shoulder replacement, most people are feeling really good at about 3 months. They can continue to improve for 6 months, 9 months, up to a year, depending upon the patient. But you know, a good rule is that at 3 months, people are back to doing most activities. Return to sport typically happens somewhere around 6 months.
And when you do the procedure, how long is it expected to last? I mean, is it a one-time and done?
Depends on how old you are, and it depends on the demands of the patient. So we call that the survivorship of the implant, or the survivorship of the joint. And if you read the literature, 10-year survivorship is about 95%. When you get up to 20 years, the studies are anywhere between 75 and 85%, and they vary quite significantly because patients are different and circumstances are different, and different types of shoulders, the newer prostheses last a little bit longer, but we think they do based on lab data. We don't have quite the same real-world timeline to judge them on.
Any risk that you worry about in doing a replacement?
There's a lot of risk. A lot of people have osteopenia, or their bones are weak, the precursor to osteoporosis. It's difficult replacing a joint in that setting. Sometimes the bone stock that we have to put a joint in isn't good. That can lead to problems. There's always the risk of a fracture afterwards if you have a trauma. Certainly, a joint infection is also a risk factor for people, just like hips and knees.
Okay. Well, thanks for the care you give the patients. Thanks for coming in and tell us about it.
Thank you very much. Appreciate it.
And if you have shoulder pain, Dr. Marwin can help. We'll be right back.